Today I'm going to be speaking about ADHD and Ritalin in children. Although adults can have ADHD or ADD as well, I am going to use this presentation as a time to prepare a parent for dealing with explaining a little bit more about ADHD, what it is, and the medications, Ritalin, that we're going to use for it. When I'm presenting this, it will be like I'm speaking with the parent. I have attached the handouts that I would give to the parent so that they would have information to go home with as well. So we're going to be talking about Ritalin. So I will be using this as, like I said, I'm talking to a parent. So your child has been diagnosed with ADHD, and I'm sure that you know a little bit about ADHD and you've heard things about ADHD, but I'm going to give you a little bit of information just to kind of overlook it, see what we can find out about the ADHD that maybe you didn't know, what are some signs and symptoms, and what the Ritalin will do to help. So with the attention deficit disorder, there are three components, and one is inattention. With inattention, you will see a failure to give close attention to details, a difficulty sustaining attention to tasks or play activities. They do not seem to listen. They do not follow through on instructions in school. They have difficulty organizing tasks, and they avoid or dislike tasks that require a sustained mental effort. They lose things that are necessary for these tasks or inactivities. They're easily distracted, and they often are very forgetful. So this is the inattention piece of ADHD, which is the attention deficit disorder as well. The hyperactivity piece comes in when you experience your child fidgeting with their hands and feet, they leave the classroom or other situations unexpectedly. They run about and climb on things where it's not appropriate. They have a difficult time playing in just leisure activities. They seem to be on the go all the time. They talk excessively. They're very impulsive. They blurt out answers when questions are not even completely asked yet. They have a difficulty waiting turns. They interrupt or intrude on others. So those are the two main, I said there was three main pieces, but those are the two main pieces. And in order for your child to have the attention deficit disorder, they have to have 6 or more of the following of those symptoms, which are on your first two handouts. So these are things that I'm sure you have seen in your child and kind of always wondered if it was a problem or not. So some little facts about attention deficit disorder is that the hyperactive impulse or inattentive symptoms have to be present before the age of 12. Although adults can have the ADD and ADHD, they usually have had it most likely for a longer period of time since they were younger. Maybe they just dealt with it in a different way. Their hyperactive or inattentive symptoms have to be present in 2 or more settings. So that means in schools or at home, or maybe in if they're in like a daycare situation. It could possibly be even when you go anywhere, like to the store, or if they're in like a sport or anything like that. With this, there has to be a clear evidence that your child has suffered in either their social or occupational functioning. So, with your child, you've seen it in school where, the grades have gone down or they can't sit down, different things like that. So getting all the information that we've gotten is really important from teachers and from parents and anybody that is involved so that we can come up with the right diagnosis, which is what we came up for your child. The other thing that we need to mention is that these symptoms are not exclusively during the course of another mental disorder. So if your child had another mental disorder, then this might go along with it, the impulsivity and that type of thing. But in this case, We just have the diagnosis of attention deficit disorder. So kind of going with what are some of the possible causes? There's lots of rumors, of what it could be, but there's really not a clear-cut diagnosis for what that looks like, for the etiology of it, what it came from. Some things that they have thought maybe are, they have found that it is 4 times as likely that the child has a relative that has ADHD. So you may know someone in your family. It's a brain chemical that is involved called dopamine. And the thinner brain tissue in the areas of the brain that are associated with attention, the brain tissue is thinner in those areas. So that has been something that they have found genetically. There's also been things said about nutrition of foods and sugars and food additives, a deficiency in omega-3 fats. In the environment, they've mentioned that maternal smoking when pregnant or lead exposure, and also brain injuries. The possible frontal lobe damage can also cause ADD or ADHD. These are all things that they do not know for definite, although the gene it being in the genes has been something that has been more researched. So the medication that we're going to use is Ritalin. Now, Ritalin is the brand name, and methylphenidate is the generic name. This is a stimulant drug, and it is used for ADHD and also for narcolepsy. It's a stimulant drug, which you would wonder why you would use a stimulant drug for someone that's already hyperactive. But how it works is that it increases the dopamine in the prefrontal cortex of the brain, which therefore activates the back part of the brain. Not the back part, but the other parts of the frontal lobe. So if you're looking at the next slide where it says frontal lobe, the areas of the brain that control problem solving, planning, understanding other people's behavior, and restraining our impulses are in that frontal lobe. And if you look at the picture, which I have right here, the prefrontal is up here, and it actually will go ahead and stimulate that, so that part of the brain, the stimulant will, so that it will also stimulate some of these back parts of the brain. So your child is on Ritalin, and there are some side effects. So I'm going to go ahead and let you know what the side effects are so that you can be aware of things to look for. These are not things that happen all the time. Some things are side effects that may need to just kind of be worked through, but they will start your child off on a dose that is lower so that they can ease into it and not give them too high of a dose, so that you can figure out what the actual dosage is. So that you will talk to your doctor about that is prescribing it. But some of the more common minor side effects are abdominal or stomach pain, headache, stuffy nose, trouble sleeping, loss of appetite, nervousness, and unusually warm skin. So those are more common side effects, but they are things that you might have to, kind of work through and kind of see if they go away. Just like with any medication that you take. Some less common side effects would be anger, dizziness, talking, feeling, and acting with excitement, drowsiness, fear, irritability, muscle aches, runny nose, scalp hair loss, and nausea. So any of the side effects that you have, you definitely want to talk to your doctor about. And really, since your child is young, you want to make sure that you're really looking for those signs as well, because they may not be able to tell that to you, how they're feeling. So that is something that you want to check on. Make sure that your doctor is aware of, what is going on with your child. Some major side effects that are more common are like a fast heartbeat, and that's probably from the stimulant piece of it. And in children, they have talked about a stunt in growth. So they do not have any clear-cut solutions, or not solutions, but if that is really what happens. But it is something that when you go to the doctor, you definitely want to make sure that you're keeping track of their growth and making sure that they're growing, which your doctor should be also aware of. And they should know that they're on this. If they're not the ones that prescribed it, they should be you should let them know that they should be checking that, and that they're on that medication. Some less common major side effects would be chest pain, fever, joint pain, skin rashes, or hives, which can also be from an allergic reaction to it. So those are things that you definitely want to make sure that you are aware of. So some reactions with other drugs would be antidepressants, blood pressure medicine, blood thinners, alcohol, seizure medicine, which are all things that most likely your child's not on. I'm not really sure what they're on at this point. We can kind of check that out. But if they're not, then that's good. It's good to at least have this so you know that those are. Some other things, though, that you might actually put your child on is a cold or allergy medicine that contains a decongestant. So if you do need to do that, you always need to let your doctor know and make sure that it's okay with them and that they've approved it, or at least talk to the pharmacist or someone so that you know that it's not interacting poorly with the Ritalin. When it comes to blood testing, the blood tests are not required. Ritalin does not build up in the bloodstream, but some doctors might want to have a blood testing every 1 to 2 years. Just to be thorough, they may want to do that depending on how long your child is on the Ritalin. This is not something that they will necessarily have to be on for the rest of their life, but you do need to make sure that you use it as prescribed. It is a very good idea to keep it in their system so that they can really be on an even keel for a while and know what that looks like. I know that sometimes, if you are good with them at home, but it's in school that you find that they have the inattention, to stop it like on a Friday and start it back on a Monday, that could mess with the chemical balance that's going on with the dopamine. So it's good to just use it as prescribed and then talk to your doctor if you think that they are doing better and you want to try it lower. Those are all things that you can definitely talk to your doctor about. So the risks of stopping the drug without consulting a doctor is that long-term use of Ritalin can cause dependence on it. So consulting a doctor will reduce the medication slowly, and that is usually the best option. So some of the side effects of stopping Ritalin might be feelings of extreme fatigue, depression and other mood changes, and changes in heart rhythm. So this is really important to talk to the doctor if you feel that you want to start taking your child off this, or if it's suggested by them, what is the best protocol for that. So an overdose of Ritalin, you can have an overdose of Ritalin because you'll be giving your child their medications. There's a good chance that they won't be overdosed. But if for some reason there is an overdose, some of the symptoms that could be seen: psychiatrically, euphoria, confusion, psychosis, delirium, and hallucinations. Those are some of the psychotic symptoms. Some motor or behavioral symptoms would be aggressiveness, repetitive behaviors, involuntary grinding of the teeth, disoriented behavior, obsessive compulsive tendencies, repeated touching, and stereotypic confusion. So those are all things that if there was an overdose, this could happen. Like I said, you will be prescribing this for your child, or not prescribing, but giving it to them. So hopefully this is not something that you would have to deal with. But as they got older, if they were taking it themselves, these are things that you would definitely want to make them aware of. So the last page of my handouts for you is just some websites that have some great information on them about Ritalin, about ADHD, just some things that you can read up on if you want to. They've just got a lot of information, and you have to know that whenever you feel like there's not something right or you have questions, you can always talk to your doctor, the prescribing doctor. You can always talk to, me as the counselor, and just kind of, make sure that everything is good for your child, because that is the number one priority, and you are your child's advocate, so knowing the information and knowing what to look for is really important. So I hope that you feel like you've gotten a little bit more information and that you're feeling comfortable with this. And if you have any questions, just let me know and we can work it out.